Okay, good afternoon. Thanks for joining us. Today, and I want to thank you for everything that you're doing to forward NASA's mission and also work to meet the guidelines, keeping yourself and your team safe. So, Vanessa and I thought it would be a good idea to do these town halls once every 2 weeks. At least that's our plan today. We did a recorded version 2 weeks ago. And we'll see how that goes. I think probably communicating clearly on what we're seeing at JSC and what our strategies are is effective. We'll look forward to feedback from you about how helpful these are too, by the way. So again, I mentioned we did we did a recorded 2 weeks ago. We did a supervisors meeting a week ago, which I thought went really well too. And so some of those things you might hear again today. So if you've seen them, again, it's to try to be a little over-communicative if we can be, rather than not enough. I do want to remind everybody that in the midst of this pandemic, NASA is not the experts. The experts are really the CDC, and we count on them. We follow their guidance as adapted by headquarters. Headquarters has done a really good job putting a framework together, taking that guidance and applying it to NASA. And then here at JSC, we have a team, as I've mentioned before, called the PERG, run by Vanessa, that interprets the headquarters guidance and then makes it applicable to JSC and actually implements it. So that's kind of how it flows. But it's important to remember those are the experts that we're resting on. Fortunately, at this center, we also have flight surgeons and a lot of expertise led here by Terry Taddeo, who is great at interpreting that and helping us work through some of the specifics that aren't clear in the guidance. Right now, we're currently at stage 3. If you go online, you can find those the different stages of the pandemic response. Vanessa and I kind of jokingly refer to us at being kind of a stage 3.8, kind of a high 3. Just to emphasize that really we're getting down to specifically the real mission essential work relative to things we're asking people to come on site to do. So in my upfront statement, I will answer some of the questions that we've been given, and one of them was why we're not at stage 4 when there's several other centers are at stage 4. So it's a great question. If you look at stage 4, it says that the facility is basically closed. That's what it says. That's the key part to me. To me, I think of that similar to what a hurricane ride-out event would be like. If you remember, and we've gone through them where we've gotten to a point where we've passed mission control to some other location that's safer, and then we get down to just a few people making sure that the buildings are safe, but the center is closed. So we can't really be in a ride-out condition. This is not going to be something for a few days, right? It could be certainly at least for another month. And right now, we have nowhere to hand this work off to. We need to continue to control space station, launch and landing of the crew, processing all the food and everything else to fly to space station, getting commercial crew ready. So we still have, I think, over 500 people coming on site roughly. And so I want to make sure that the facilities, one, are safe, so we have security that's necessary, clean and secure, so we have the maintenance staff as well as the facilities people here. Because those folks who are asking to come on site, I want to make sure that we're making it easy for them, not harder. So I don't know that we'll ever go to 4. But the key part of what we are doing, and Vanessa and the PERG are a key part of this, is to continue to look at that list of things we're asking people to come on site for and look at every detail about how we do that to make sure we feel like we are meeting the requirements of the CDC and social distancing. So that's the background. And Vanessa will talk more about that, including some recent updates. So again, I want to applaud all of you who are finding new ways of doing things in this environment. I've mentioned before, I feel a reduced productivity. It's just a fact based on this new way of working. And many of you have kids at home or elderly relatives that make your productivity more difficult. So we recognize that's the case. Again, another reminder, it is okay and reasonable to talk to your supervisor about these limitations and have a dialogue with them about the program milestones. There was another question about, are we looking at milestones in general and workload? So the answer is absolutely yes. We work with the programs as well as headquarters on certain things. I know the budget, PPBE, has moved a couple of weeks. That's very helpful. We know that Commercial Crew and ISS recently have made an agreement to move Demo 2 launch date a couple weeks to the right. That's still being finalized with all the people that needs to be a part of, but that's a beginning. You know, as we looked at the workload that was coming in and the time it was taking to get the paper and other things closed, that they needed to move that. So that, to me, that's an example of, you know, the people responsible are looking hard at the milestones in the work and making and updating plans. It is important, though, and I think you know this, that we're not just going to cancel stuff. We're going to look at what makes sense, and we need a plan as to when the new date should be, not just canceling things. I've seen a couple of cases where I know the team is getting to the point where we realize that this is not something that's going to just end in a couple of weeks. And so there are some real important events coming up, some training events. There's a flight readiness review that we need to start thinking of how we're going to do those in this environment. In other words, not throwing our hands up, but say, hey, these are very important events. It's important to do them right. Communication is very important. How are we going to adapt in this environment and keep the social distancing and the safety requirements intact and put those together? So I appreciate everyone who's fleshing those out as well and thinking about allowing us to execute our plans. So anyway, that was it for me. I'm going to pass it on to Vanessa.
Okay, thank you. Good afternoon. I hope that you and your families are doing well. I'm getting used to the pace of the telework day. I know for others that may have children, as Mark mentioned, that it's probably much more difficult than what I'm dealing with. I do encourage you to take advantage of the resources available to us. So there were several questions that came in via the Conference I.O. related to the PIRG. As we start every PIRG, we have Dr. Taddeo and the occupational health folks give a status of where we are with regards to the center. So I'm going to ask Dr. Taddeo to do that, and then I'll pick up again. So.
Okay, so thanks, Vanessa. So good afternoon, everybody. And I know that all of you are following along, as are we, in the news media, social media, NASA updates, what the current situation is locally and across the country with the pandemic. So what I'll say broadly is that across the nation, we continue to see an increase in the case rate and the number of cases in given localities. Some places have been hit harder than others. What I will note here is that for our local area, and in particular Harris County, as we look at the numbers, we see that Harris County is not on the same curve as the rest of the country. So that is, we are in better shape. So that curve, well, the rest of the country is still on a fairly steep slope. The curve for the case rate in Harris County is actually beginning to flatten out. So that's positive. And that is due to the diligence by everybody involved, i.e. the citizens that live in Harris County and the surrounding counties, actually. And in particular, our folks at JSC, in implementing that guidance and being diligent about staying at home or practicing social distancing and doing the hand washing, self-isolating if required. So there is some good news on that front. We are clearly not out of the woods yet, and there may be some weeks to go before when we can start backing out of the situation becomes clear. But from that standpoint, I'm encouraged by where we're going. So I think that's all I have to say on that for today.
Okay. So as Mark mentioned, the center is operating under stage 3 of the agency framework. What that means is only mission critical, mission essential personnel that cannot do their work via telework are on site. And travel is mission essential only. It's very limited, and it has to be approved by the center director. So we're estimating that about 90% or more of our workforce is teleworking. For those that are on site, as I mentioned, we have the PIRG, and every day, actually, I get a status of what's going on in the local environment as well as the national environment. So I want to say thank you to the occupational health guides and to Dr. Taddeo, and as Mark mentioned, all of the other representatives of HMTA that helped to make that happen. So as Mark mentioned, because of the critical roles that we have to make sure that we can continue to do this work within the guidance that we have. And so we keep a close eye on what's going on and using the CDC guidance and other guidance that we're getting from the agency Chief Medical Officer, Dr. Polk, to make sure that we're mitigating risk. What we're doing here at the center is all of the tasks that are being performed on site have a review to make sure that they're being done within the guidance. As Dr. Taddeo mentioned, making sure that we have 6 feet spatial distancing and that we have the hygiene available. For example, there's a sim that's going on today currently for the commercial crew program. We've reviewed the layout of that area. The occupational health folks have made sure that there's additional hand sanitizer, but we've made sure that everything can be supported and to meet the guidelines. We not only do that just for the operations that are going on, but as well as for hardware. We have GFE projects that are continuing, but same thing happens. We review the procedures. There's someone that makes sure that all of those checks are in place. So we feel that we are mitigating and meeting the guidance as required. I will say that we did issue an update to the center guidance on last week. We updated to give information if you're completing a quarantine, what you need to do, or if you have had COVID-19, what you need to do. And that information has been posted on the JSC internal webpage. So in the questions that came in, I do understand that there was some confusion because the COVID pane was taking you to jscsos.com and the information there had not been updated. We are making a correction to that. So we will make sure that now that the COVID pane that's on the JSC internal page, when you click on that, it'll take you to the center guidance. The PERG met on yesterday, and Dr. Shaw actually put together a nice little handy checklist, if you will. So it takes all of the verbiage that was written in the guidance, and it's a nice little flow chart that makes it much easier for people to kind of flow and understand what they need to do. So that will be available as well. And in addition, we're going to start posting a short center status. There was a question that came in asking could we get that information available. So we can do that. It will be on the internal page. The jscsos.com is a public-facing site, and so we cannot put that data there. So we will make sure that you'll be able to get it. The specific question was, could we get information about the number of positive cases at JSC and for JSC personnel at other locations? So we are going to be able to do that. Additionally, the person or someone asked if there was something that could be done for employees that was recovering, and I think that was very nice of you to ask. But for privacy reasons, we don't know the names of the individuals, and we would not give their names out. But for the data that we do have, we are collecting from our civil servant leaders as well as the contractor leaders the number of people that are in quarantine, the number of people that are positive for COVID-19. We are actually getting that information not just for on-site, we're getting it for near-site and for other locations where our personnel are traveling to. However, because we don't want to cause any confusion, the only information that we will post will be that information regarding on-site personnel or personnel that are traveling. So I will say that as of today, we have had 4 positive cases involving personnel that are JSC employees that work on site and 1 person that was traveling. I want to make it clear that because of the fact that we went to the mandatory telework, individuals were already teleworking. 2 of them were teleworking when they became positive. Then we had another individual that was on international travel and never came on site. So 3 of those individuals never were on site when they had symptoms. We have recently had 1 case where we had an employee that had symptoms while on site, and had received medical care, but that person did test positive. So in that scenario, we have our occupational health employees go and make sure that they make contact with the individuals that would have been in contact with this person. We do have people that were quarantined as a result. This individual was an outside worker, so the truck that individual was using has also been quarantined. But I want to make clear that this is the one case that the employee has been taken care of, and additionally the area has been disinfected, and we have had that situation contained. At the Pergon yesterday, someone asked the question of, well, how do I know I didn't walk past this individual? And I want to make clear that for this particular scenario, you would not have been in contact with that individual. However, want to keep in mind that, as Dr. Taddeo mentioned, 6 feet spatial distancing is what we're saying is required on site, and you should also be practicing at home as well. And if you maintain that, would not be of a concern. So we're just making sure that we're following the 6 feet social distancing and washing hands frequently. That is the way that we're mitigating the risks that are on site, as well as we're doing additional cleaning on site in places where we have high traffic. I think Dr. Taddeo is going to talk to you a little bit more. There was a question that came in regarding masks, so I'll let him talk about that. But I will say that we will be updating our guidance on the homepage regarding the guidance that just came down from the agency chief medical officer with regards to using personal masks. One other set of questions came in. There were several questions that came in with regards to IT. So I reached out to our CIO, Annette Moore, and for general guidance, we're pointing you to the NASA People site. There were some questions regarding Teams, the use of Teams for SBU and ITAR purposes. This data must be encrypted, and so there are guidelines that are being updated to address how to do that using Teams. One of the questions regarding Teams was near and dear to my heart, because with Teams, you basically have to sit in front of your computer to communicate, and it basically keeps you in your chair. And so having mobility is needed for those of us that may have people that we're taking care of, or we may be on the move. So there are 2 initiatives that are being worked on to have a mobile Teams app that will allow a chat voice and for you to join meetings using Teams, and then also to have audio conferencing added to Teams, where you will either have a number that you can dial into or have Teams call you. That pilot testing is underway, and they believe that we will have that implemented in early May for Teams. There was also a question about Zoom, the use of Zoom. Due to IT security concerns, NASA has not authorized the app to be on our IT equipment. You can participate in Zoom meetings via the web portal, but they are cautioning you because there is known hacking vulnerabilities. So if you use Zoom, which I did use it for the first time for a family chat, and I found it was very useful, but just be careful because it can be hacked into. Let's see, there were also other questions about the performance of hardware and the need for high-speed computers. I will say that all of the IT purchases are authorized by individual organizations. So if you feel like your equipment is not operating, or you don't have the capability that you need, you do need to contact your supervisor. And while you're teleworking, be sure that your home network and that your Wi-Fi has the signal strength needed to support applications. And that was most of the majority of the questions. There was one question about logging of telework hours. I was not familiar with that practice, so I did reach out to HR, and what I was told was this was something that was done when we first started the teleworking, and this was maybe where you would log what work you did and how many hours you did over the course of a day. I will say that while we're under mandatory telework, each of us should be communicating with our management about the tasks that we're doing. And with capturing our hours for civil servants in web tabs, I'm sure the contractors do that another way. It does seem that this is probably a burden that we should not enforce. Because this received 7 votes, I thought it was not an isolated incident, so I thought that we should talk about that and just suggest that you meet with your supervisor and discuss other options. And other than that, those were the questions that I was going to address, and I just want to just say, as Mark said, thanks for your time, your continued support of NASA's mission, and stay safe. I think, did you have some other comments,
I do, yes,
Terry?
actually.
Okay.
Thanks, Vanessa. So thanks again as well for everybody for taking the time to listen in today. I just want to give an idea of how our occupational health team and medical team are working to support the efforts of the center and of Vanessa's PIRG. So what we're trying to do is we're working hard to provide guidance on how guidance from CDC and headquarters can be implemented in our workplace here in order to protect our people and to protect the mission. We're trying to develop guidance that helps the supervisors make decisions and try to push that decision-making ability down there with regard to if an employee is ill or they have questions about return to work, to try to make that easier. One of the challenges that we face is that, no joke, the landscape seems to change daily in terms of, well, what testing is available, what guidance has come out of this location, what guidance has come out of that. And with all of that churn, there's a little bit of drag time or lag time in between when that comes out and then we can actually come up with formal implementation here. So I appreciate everybody's patience with that, but we are working to maintain a consistent response to these things so everybody is working off the same recommendations. So as much as I would like to say we're at a steady state, we're not there yet, only because, well, the center is at this stage, these other recommendations and these other things out in the real world bring up other questions. So in that regard, so we're continuing to work with for example, ISS and with FOD to manage not only best practices in the workplace, but how to deal with requirements that are being levied internationally. In other words, there are requirements levied by the government of Russia and Kazakhstan on Americans traveling there. So we had to work with these programs to figure out how to enable these upcoming launch and landing events. That's taken a lot of time. I think we got to a good place. I also want to address lately, in regard to these recommendations, now there's interest in when it is appropriate to use masks or face coverings. And let me address that for a minute. So at the end of last week, the CDC came out with recommendations about using face coverings, and I'm using that word, and CDC is using that word to differentiate that from masks, which I regard as manufactured and designed for use in a medical setting predominantly, or first responder setting. So with regard to these face coverings, the notion was that, and I'm going to quote partly from their own language, the CDC recommended wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, and especially in areas of significant community-based transmission. So in other words, if you're out somewhere in public, and their thought was if you're at the pharmacy or the grocery store, and you cannot maintain that social distancing, to protect others from you, as opposed to protecting you from others, the idea was to wear this cloth face covering. What's behind that thinking is some evidence that before you become overtly symptomatic, before you have a fever or coughing or sneezing, that you may be shedding some virus. And so to cut down on that route of transmission, that's why they're recommending to use this face covering. So again, I want to emphasize, it's not to protect you from others, it's to protect others from you potentially having been infected. So having said this, Dr. Polk sent out this morning, I believe, he sent out guidance saying that he encourages NASA employees to do that, again, in areas where it's difficult to maintain that social distancing. I will point out that at JSC there are relatively few areas where you can't do that, between the open areas and the fact that we have relatively few employees here. And also point out that Our area is not considered at the moment to be one of significant community-based transmission. We're not a New York City or New Orleans. So, well, it's not a requirement here. If you feel that you want to, no one will stop you from wearing a face covering. But at this point in time, we're not requiring that. And again, I want to emphasize that what we're really emphasizing is the social distancing and other behaviors. If there is mission essential work that is being performed, and for whatever reason social distancing can't be maintained, then we are working with whomever is performing that work to advise them on how do we implement a best practice, in other words, to protect people from exchanging the virus. Okay, so with that said, and then lastly, because there are still questions remain about, all right, we have face coverings, but when do we use these actual surgical masks or N95 or others that are available? We're trying to come up with some guidance here that we will offer then to headquarters and potentially help clarify that in the near term. And I'll just pass on that I actually looked at a draft of that just this morning. So I'll show that to you, and then I'll send that to Dr. Polk, and we'll see where we can get to. Let's see. I also want to emphasize that, just to go back to something Vanessa said, what is an exposure? If you pass somebody in the hallway, if you pass somebody in the stairwell, you pass somebody in the sidewalk, if you were in a building and it turned out somebody on the 5th floor turned out to be COVID positive, and you're on the 1st floor, those are not exposures, and those are not things that you need to worry about. And certainly, we will do our best in an area where someone was working and they were determined to be positive. We go and clean that area up. Let's see, just want to make sure I hit all the high notes. Again, we're trying to work with supervisors in advising them when people can return to work, who can self-quarantine, who should be self-isolating if it turns out that they're ill. The question had come up recently about what happens with an employee who has a family member or someone in the household is working in the medical field or is a first responder and may have an exposure to someone who has the infection. We are putting together a plan for when that individual would need to self-quarantine and when it would be acceptable for them to continue to come to JSC. There was one question asking about how some of the people, some of our JSC community who had contracted the virus, how they're doing. What I'll say is that they're under the care of their medical provider, they're receiving the appropriate care, and just for reasons of medical privacy, we can't say more than that. But I appreciate the interest. I will say at this point in time, though, I would extend a plea to everybody. If you encounter or learn of somebody who's ill, please don't stigmatize these folks. I think you need to take into account that this is an infectious virus, and it's just as if somebody getting the flu or some other illness. Sometimes, despite our best efforts, these things happen. So, please take that into account. And one last point I'm going to plug again is to remind folks our employee assistance program is still up and running. They're not doing face-to-face meetings anymore, but you can still speak with them over the phone or one of the other platforms. And I think that's all I have.
Great. Thank you, Terry. That was really, that was awesome. And I think it's a great example of that we have a plan. The plan's got to adapt. Things change. But also, I think that clarity on exactly what is the intent, right? And I like the word face covering too, because we are still worried that medical people get the masks that they really need, and so we need to make sure that we're meeting the intent. I did want to point out that we do this meeting together because there's 3 of us, and we really felt it was important that the 3 of us are adding important pieces to do this well with the team. We thought it was important to do it together, but we are 6 feet apart. We don't do a hug when we get in the room, right? That's obvious. And so we try to practice what we're asking other people to do that we believe is safe. I do have a cloth mask that I brought to work today, and when I leave, I'll, if I need to go, especially if I need to go to the grocery store or other things, I have that capability, again, to protect others. So thank you, Terry. Well done. There were a couple of questions that I didn't put in my speech that I wanted to make sure I mentioned. So One was, are we considering making permanent changes based on the lessons learned from this situation? For example, enhanced cleaning procedures, greater ability for employees to telework, basically. So I think they're very, very well maybe. I don't know what they are yet at the moment, right? We're still in the midst of this. As I said before in the supervisors meeting, if coming out of this, the CDC recommends, hey, you know, there's a particular cleaning technique that can really cut down on the likelihood, then we're going to take that into account and look hard at what it makes to do that. So we'll see. We'll see. Again, we're going to follow the experts' recommendations. As far as telework goes, you know, I think already we have the flexibility to do a lot of that. And it really depends, again, on the work, the specific type of work. I do think we're all learning a little bit more about the positives and the constraints of this particular work technique. Some I think we're learning there's more capability than we expected, and I think we're also finding in some areas it's a little harder to do certain jobs. So, but I think the tools are improving, and Vanessa talked about a few. We're really blessed. There's so many tools and opportunities. Yep. I think we're learning which ones are the best, and I think each one of us, Vanessa mentioned, I've had the same thing. Each one of us is learning how to use some of those tools more effectively. Like sometimes when I do Teams, I don't even turn the video on because you don't have to. And at some point, having people stare at me the whole time for an hour just feels, you know, I just, anyway. So anyway, it's a personal thing. Let's see, I already talked about that one. There was a particular question about, again, it's really about IT, but it's a particular question about devices being connected to the laptop and a particular organization that is implemented different than others. I've forwarded that on to that organization to see, you know, I know that they have some specific security concerns, but they're taking a look at that and seeing whether they can be more flexible in that too. Again, still do their job. Another good question, until a vaccine is available, are employees going to be forced to work on site and risk exposure? Can they continue to telework until they feel safe? What about employees with a higher risk of developing complications? So I don't know when a vaccine will be available. It could be quite a while from now. So I do think that although we are still working on a plan for re-entering back to the workforce, and we're going to do that in an orderly, smart way, it wouldn't surprise me that we'll start that before a vaccine is available. In fact, I'm almost certain that's true. So we're, you know, I don't want to, so we're going to work through that, and we're going to make sure that we feel like we've met the requirements, the CDC guidelines on how to go do that as we ramp up, and then we'll see. Again, if people have specific concerns relative to their health, I know that we will work with them on those cases. So I don't want to predict too much in the future, but that's a great question about concern, and again, we're going to ramp in a reasonable way when it makes sense. There was a question about, you know, we are in the federal government, we're fortunate in that we have the opportunity to provide, if it makes sense, 20 hours of paid administrative leave per pay period for civil servants who have constraints like young children or so forth. That, again, supervisor's discretion where we have that. So the question points out that contractors don't necessarily have that in the contract, and is NASA pushing contractors to follow suit? What I would say that it depends on the contract. You know, we would have to talk about the contract language. I would say though that I believe that it would certainly make sense to me that the programs that are and the institutions that are responsible for those contracts have dialogues with their contract personnel about their ability to execute the milestones based on these constraints that they have. So I'm certain that people need to be considerate of that. And again, as I said before, we've already taken steps to make sure that those that cannot come on site and are prevented from doing their work on site, that we're still going to be able to fund those contracts and keep those people. There was a question about what are the chances that employees would be furloughed due to the schedule slips on various projects. So I think those chances are extremely low. In fact, I'm not sure why. You know, we're doing telework, we're progressing. They're providing us flexibilities for certain cases with charge numbers. So I think that's very unlikely today. And then we had a question about why Vanessa, and me, we're not teleworking. so actually, Vanessa's doing an awesome job. She is teleworking a ton. I have been, I'm kind of transitioning into that. There's some things that I feel like I am more in touch with when I'm here. There are some things that still require my signature, not as many as you might think, and I think we're doing better about electronic signatures, so some of that is true. But I'm transitioning into more and more of that myself. It's a great question because the other thing is there aren't a lot of people on this floor because we've sent our staff out to do teleworking, and so often it's just me and Vanessa, and our offices are pretty far apart. But it's a good question, there are only a few things that I really need to do right here, and so I am transitioning to do more and more teleworking. So I think those are all the questions that I had. I don't know if we had any others. I think that's the list. And I want to thank Vanessa, you for your leadership of this PERG and helping the center work through this, and Terry for your guidance and sound wisdom. I really appreciate that in this time. So thanks again for everything that you're doing every day for NASA's mission and keeping our workforce safe. And we'll talk to you again in 2 weeks. Thanks.
Thanks.
Thank you.